All right, good evening and welcome to Postgraduate Training Opportunities in Community Pharmacy, the second of 3 web meetings in NCPA's Future Pharmacist webinar series. My name is Alexander Tu and I am the NCPA Executive Resident. I will be your host for today's call. Before we get started, I want to let you know that this evening's web meeting is being recorded. The slides and a recording should be available within 5 business days at www.ncpanet.org/residency. I do want to remind you about our final webinar coming up. Community pharmacy residencies are on the cutting edge of modern pharmacy practice, and we want you to hear about the possibilities. On Thursday, November 17th, you'll get an insider's view on life as a resident and unique projects that advance patient care. We'll have residents from the University of Kentucky, South Carolina College of Pharmacy, and a new collaboration with NCPA, the University of North Carolina Independent Pharmacy Ownership Residency Program. We hope you plan to join us. Tonight, we've brought together 4 community pharmacy residents from across the nation to share their experiences so far. Without further ado, let me introduce our panelists. Dr. a community pharmacy resident at Stanford University in the Porter School of Pharmacy and is a graduate of Presbyterian College School of Pharmacy. Next, Dr. Anna Shields is a community pharmacy resident at Kelly Ross Pharmacy Group and graduated from the Drake University College of Pharmacy and Health Sciences. Finally, we also have with us Drs. Cody Clifton and Ryan Wheeler, who are both community pharmacy residents at the University of North Carolina Eshelman School of Pharmacy. Dr. Clifton is a graduate of the University of Mississippi School of Pharmacy, and Dr. Wheeler graduated from Campbell University College of Pharmacy and Health Sciences. And with that, I will turn things over to our residents for a brief presentation, followed by a moderated discussion. We have reserved the final 10 minutes for question and answer, so be thinking about what things you may want to ask our panelists. Casey, go ahead and get us started.
Hi, so I'll talk today about Stanford University's PGY1 Community Practice Residency. So we have 2 community practice sites. First is Chad's Payless Pharmacy, which is my practice site, and we also have Christ Health Center, which is another practice site. So first, a little bit about Chad's Payless Pharmacy. We're a family-owned and independent pharmacy. Our owners also own Singing River Healthcare Clinic, which is adjoined to the pharmacy here in Florence, Alabama. A lot of our services here at the pharmacy include travel and adult immunizations, biometric health screenings, MTM services. We also do adherence packaging or bubble packs, like we like to call them. We also do diabetes education, so we hold classes every 2nd and 4th Thursday night in the clinic waiting room. And we're also in the process of initiating a cardiovascular clinic, so we'll be enrolling patients within the coming weeks where we will monitor their blood pressure, their diabetes, and their cholesterol, and we'll see those patients on a monthly basis. As far as immunizations go, we also not only administer them at the pharmacy, but we also try to set up flu clinics around town. So we'll go to doctor's offices if they want us, or local businesses around the town to provide immunizations for their employees as well as their customers. So next is Christ Health Center. So this is a little bit of what it looks like. It is not located in Florence. It's in Birmingham. It's just down the street from Stanford University, so it's a little more local. And Florence is about 2 hours away from Stanford and Christ Health Center. So they are a federally qualified health center. They provide several services, so they have medical, dental, and pharmacy services. And they were founded by a local church to meet the needs of the underserved population. And they do practice a faith-based approach to care. So a lot of what they do is a patient assistance program. So they submit all of the paperwork and everything to get patients the medicines that they need. They also do a diabetes clinic where they focus a lot on insulin and dosing, and they also do travel medicine, which also includes immunizations and everything as well. Here, they sort of have a closer relationship with physicians. So a lot of times on pain clinic days, the pharmacist there, or my co-resident Marie, will go with the physicians and help facilitate those appointments, as well as help them with any other needs that they may have. So here are our learning experiences that we have for the residency. So we focus on patient care, which is a majority of what you would do. So as you see here, it's usually about 20 hours per week. It may be more, it may be less, depending on the opportunities that you have on a given day. A lot of it includes the services that I just previously mentioned with immunizations, health screenings, and things like that. Then you have dispensing and operations. So basically that staffing in the pharmacy and dispensing meds. So that's usually about 10 hours per week, again, give or take, depending on, what's going on that day in the pharmacy. We also do teaching and training. So we have a teaching certificate that you are able to get, and there's certain activities associated with that. So you have to teach some labs and classes, and also do a CE that's due in December. We also have practice management. This is more of a class, so we usually schedule a class once a month, and we'll all either get together or do a WebEx meeting, and we'll talk about basically the fundamentals of owning your own pharmacy and going over income statements and calculating cost of dispensing and different things like that. So all of the foundational things that you would need to own your own pharmacy later on if that's one of your goals. We also do research, so whatever you have an interest in, you can do research in that area. This year, my research is with statins and diabetics, so the goal for me is to get all of our patients that are diabetic on a statin. And then we also have public health. So we engage in healthcare reform discussions and provide services to the community. So with this, it's usually in the form of health fairs and different things like that. So opportunities, they're kind of the same as some of our learning experiences. So again, we have the teaching certificate. You can also get APHA training certificates, and usually this is in travel medicine, so you'll do the training certificate for travel medicine. You get the research certificate again. You have CE presentations, and we usually publish at least one article through U.S. pharmacists each year. We also have elective rotations. They're not really defined, so during the residency, if you find that you have an interest in, long-term care or anything like that, then they'll facilitate you getting that experience, whatever it may be. Another thing that falls under the elective rotations are mission trips. So they're usually a week long, and they go different places. It just depends on which places they have set up for that year, and that would be mainly through Stanford University, who would facilitate that. And then we also have travel opportunities. So we do get a stipend for this. It's $1,500, and they help pay for us to go to different meetings. So like APHA National Meeting, this is where we would go and present our research. We also go to the Alabama Health System Pharmacist meeting. So here we mainly just do the residency showcase and tell people about our program. We also go to the NCPA National Meeting and mid-year, and mainly there we do the residency showcase as well. And then we also have some residency trips that we may do. So one trip that we've taken so far is that we've gone to Atlanta to see other community pharmacies and how they've built success. So how to apply. So you would want to register with the National Matching Service and apply through Forecast. Our application deadline is January 3rd, and our required materials are, of course, the completed application, a letter of intent, a CV, your official pharmacy school transcript, and then 3 letters of recommendation, with one of those being from a community pharmacist. And then for more information, you can visit chadspayless.com. The website is actually not up yet, but is projected to be up and running December 1st. So you can go there and investigate Chad's Payless a little bit more and see a little bit more about what we do. We also have a Facebook account at Chad's Payless Pharmacy, Inc. Christ Health Center also has an email or a web address here at christhealthcenter.org. You can also visit Stanford's website. And then if you'd like to, you can also email our residency program director. His name is Dr. Jake Galdo here at jgaldo@stanford.edu.
Thanks, Casey. Next,
Thank you.
Of course. Next, I'll turn it over to Dr. Shields at Kelly Ross Pharmacy Group to tell you about their program.
Hi, everybody. Thanks for having me on tonight. And I'm really excited to tell you about what we've got going on here at Kelly Ross. So who are we? We are an independent community pharmacy located in Seattle, Washington. And we have 6 divisions listed here that contribute to patient care across the continuum and clearly in a variety of different settings. And so our community pharmacy location is located inside of the Polyclinic building located on 7th and Madison. So we're in the heart of downtown Seattle. And within this building, I like to call it a doctor mall. There are over 154 doctors operating within one location, and so we are the community pharmacy on the first floor. So we do have a lot of patients who are seen in the clinic come to our location, and we also get consulted for a lot of pharmacy questions or dosing in that regard. And within that community pharmacy, we also have our own set of clinical services. And so we have an HIV pre-exposure prophylaxis program, and so there are pharmacists running that clinic determining if patients are eligible for treatment and running all of the lab testing and monitoring thereafter. They write the prescriptions and the whole 9 yards, so it's pretty exciting. We also have a pretty extensive travel clinic and immunizations within that as well. And so being located in Seattle, there's a lot of clientele that is traveling and a lot of businesses that have employees traveling, and so our travel business is very busy. We also have a compounding pharmacy located in the M Street Medical Building just across the street. And within this location, we're doing a lot of vet compounding, lots of women's health, hormone replacement therapy, and then we also have some innovative compounds for eye drops and different things like that. So we do both sterile and non-sterile, which means that there's a lot to learn. This is definitely an area that's been of growth for myself, and so I feel lucky to have kind of the opportunity to explore compounding as an avenue as well. Next, we have the Clinical Pharmacy Institute, and that is where the resident kind of operates out of. It's our idea center, our think tank, and within this department, we evaluate all of our clinical services for implementing, from the implementation phase to collecting outcomes data on our patients, but also whether or not our services are financially sustainable, and really pushing the boundaries on payment models and structure in that way too. And so being in the state of Washington, we actually have provider status mandated through commercial insurance here on January 1st in the community pharmacy. And so we're really excited to kind of test out the model on our in-home patient medication management program that we have. And this service is kind of run out of here, and it is something that the resident spends a significant amount of time on, is visiting with patients in their homes. There's a few different models by which we get referrals. There's transitions of care from Virginia Mason Hospital out here for our heart failure patients. Then we also have some referral systems by patients who are both Medicaid and Medicare dual eligible, and have a case manager determining what services they might need. And so if their case manager determines that medication management is an area that they need help in, they can get referred to Kelly Ross and have a pharmacist assist them. So we follow these patients for a number of months. We also have a collaboration with a housing organization for referrals for certain people living within specific buildings in the area. So lots of really cool stuff in the works, especially with provider status coming up. Long-term care, the resident doesn't spend a ton of time in long-term care, but it's definitely something that the resident can get involved with. I will be spending a month over there more into the springtime. But there's lots of technology, packaging, the whole 9 yards. And then we also have a relationship with Bailey Boucher House here in Seattle, which is a long-term care facility specifically for patients with HIV. As HIV is now a chronic disease, we have some of our consultant pharmacists who go on rounds with the physicians at that location twice a week. So that's also something that the resident can get exposure to and kind of a unique relationship. We have a mail order pharmacy. We service the Teamsters Union of Washington. And so we kind of cover sort of the West Coast in a mail order kind of fashion. But being an independent, we really do get to know our clients as we've worked with a number of them for many, many years. We also have the foundation, which is our non-for-profit kind of arm of the company. And through the foundation, we have a lot of public health outreach activities. A lot of the healthcare professions and certifications require AIDS and HIV training for licensure. And so we have a training program on our foundation's website that those individuals can use to fulfill that need. And then we are also in the process of creating some online modules for naloxone training. Here at Kelly Ross, naloxone is something that we're very passionate about, and educating our community and a lot of the entities in our area and even individuals and their families. And so that's kind of all wrapped into the foundation. It's kind of a growing sector, and we have a lot of stuff that's going into that. So the details of the program, here at Kelly Ross, it's really a longitudinal focus as the residency. And so I don't have like monthly rotations. I'm pretty much doing everything all the time, which makes for a pretty heavy onboarding process, but it's what I really wanted in a residency program. I wanted to be able to do project management, all of those things on the right, the staffing, the clinical services, and also my teaching all throughout the year. And I didn't want another year of rotations, and so this program really matched my wants. And I think from the last slide, I've kind of talked about how non-traditional and innovative we are. We've been recognized at a number of levels for our innovation here at Kelly Ross. In 2014, and actually just this year as well, two of our preceptors now received the Washington State Pharmacy Association Innovative Practitioner Award, and this year was our residency director. We also, this year, were recognized by APHA for the Pinnacle Award for Group Practice, which is regarded as one of the highest honors that a pharmacy can receive. And so we're really pushing the limits on what a community pharmacy can do. And for me, it's even more exciting that we're located in a huge city and having such an impact on a wide number of patients as a smaller organization. There's also a lot of self-directed learning in this role. There's a lot of autonomous work that is to be done. And so I think that really pushes the resident to take leadership and ownership of the things that they're working on. You're really trusted to take control and be a pharmacist, and that's something that I've really, really enjoyed. I should highlight that we are a non-accredited program, so we do not go through the match process. But I wouldn't say that limits the experience here at all. I'm still tracked through similar ResiTrack sort of system. There's still a lot of focus put on the growth of the resident and making sure that it's a well-rounded experience. So staffing, I'm staffing 8 hours a week, and that's at our polyclinic location, and then I'll staff 8 hours a month at the compounding pharmacy as well. And then, like I said, the clinical project management and teaching, that kind of is interspersed throughout the week. Teaching, you can really take it you can really make it what you want it to be. You don't have to complete the teaching certificate, but it is available through the University of Washington. And I have opted to do so. And so the resident precept students as well become primary preceptor here in a few months. And then I'll also be teaching in the classroom during the winter quarter. So you can opt to do classroom teaching or you don't have to. And so I've really liked the flexibility and kind of the ability to choose what to do within teaching. So who's our ideal candidate? There are 4 traits that we look for: adaptable, bold, smart, and adventurous. We really want somebody who's looking to push the boundaries. As I've already mentioned, that's what we do. And so we want somebody who's okay with being uncomfortable and working in areas that are unknown. We want someone who can stretch their limits and really think outside the box. We want somebody energetic, passionate, somebody who will help develop our practice and help us continue to push the future of pharmacy. So as I mentioned, we're in Seattle. There is a stipend, and a lot of this is found on our website. That'll be coming up in just a second. You do get full benefits, so medical, dental, vision, and pharmacy benefits. There is the option to start before July 1st, and you can even start before you're licensed. And so you can work as a graduate intern to kind of get some of that early training under your belt. I did that as a part of this to really get kind of a background on compounding. And like I said, we do some of that. We do quarterly evaluations, and it's tracked, and there's all these numbers and all sorts of things. So the application process is all found on our website. Everything is sent directly to our residency director. As I mentioned, we don't go through forecasts. We also do require an on-site interview, which I think was my favorite part of the whole process anyway, getting to really see the physical locations, meeting the people, hearing their stories. So the deadline to apply is Friday, January 13th. And you can see on the slide here, more information can be found at our website there. So I do just want to wrap up. Our company's tagline is "Caring is in our chemistry," and it's not just a tagline, and even though it sounds really cute, it really is something that the people here believe and they live it. And so I really want to emphasize that, and not just the way that we care for our patients, but also in how we work together as colleagues. And I just feel so lucky that I found Kelly Ross, and I couldn't be happier here.
Thanks, Anna. We will now turn things over to Ryan Wheeler and Cody Clifton from UNC School of Pharmacy for their part of the presentation.
Good evening, everyone. We're very excited that Ryan and I can join you this afternoon and talk to you a little bit about our program. So we do thank Anna and Casey for going through the details of the match process, so we won't focus on a lot of that. But as we look into our program here, we actually have about 9 different sites within North Carolina that we offer. And this is a little bit about the application process. So, of course, letters of intent, 3 letters of recommendation. And one thing that is different from most programs is the leadership statement. So UNC does focus on leadership being a quality of yours. It doesn't have to be a requirement, but it is looked upon to see how you view leadership. And then, of course, the CV. And the Residency Teaching Certificate Program is an optional program. I am a part of that. It's been very rewarding so far. You get to be a part of small group teaching, large group teaching, and also precepting. So these are sort of the requirements that you see with the program that we have here. You get to develop a teaching philosophy statement, which I'm very excited about, and a teaching portfolio that will help me throughout my career.
All right, so I'll get started with Reloj, I guess. So Reloj is pretty much considered an independent chain. They have the feel of an independent, but we also have about 18 stores. So we do have a lot of different stores which have a lot of areas that they focus on. For instance, on this list of services, you can kind of see at the bottom right, we have a specialty pharmacy. So we just built a Reloj around Campbell's School of Pharmacy, and one of the owners of that Reloj decided, well, hey, they wanted to start a specialty pharmacy. So they pitched it to the owner, and then that became one of the ploys of Reloj. And in that, it kind of lets you know about Reloj's openness to developing new services and starting new business aspects or adventures, which is one of the big things that drew me to Reloj. Anytime I've had any kind of new service or new idea, I pitch it to somebody and they're open to it, receptive of it, give it a try even if it fails. So they're partnered with Carolina Home Medical, so each store has their own DME section, which is really good for the patient bases that the areas of Reloj that they're located in. Each store does compounding, non-sterile specifically, and then we have about 3 or 4 that do sterile compounding. Each one has a 24-hour on-call service. I'll do local delivery and blister packaging. And then one of the real big things that we just recently started was the transitions of care. So I work with another resident because Reloj has 2 sites, and so the other resident is doing a transition of care with Onslow Memorial Hospital, which has been kind of like we got a grant for it. It's been one of the big pushes lately that Reloj is trying to open up and get more active in the community and more active with the local hospitals and providers. And then another thing that we're really big with is the diabetes self-management education and the diabetes prevention program. Reloj has one of the only successful diabetes prevention programs in the state. We've gone through about 3 different cohorts. I'm personally was trained as a lifestyle coach for that, and we also have another past resident that does the specific diabetes self-management education. All those have been past projects that have just taken hold, and Reloj has really appreciated and invested time and money into keeping those alive. So that's been really good. And then with the next slide, we've got the kind of the daily responsibilities for both myself and my co-resident. So I'm in New Bern, and my co-resident is in Jacksonville. And as you can kind of see, based on the employees and the amount of prescriptions, they're very different sites. So each Reloj is very similar, but each Reloj is also very different. So I'm in New Bern. We do about 900 prescriptions a day. We average probably 3 to 4 pharmacists in there at all times. So as you can imagine, it can get very hectic, specifically Mondays and first of the month. As far as my typical schedule, on Mondays I usually do CMRs and various flu clinics. I think I've probably given about 500 to 600 flu shots this season. So it's been pretty good. And then Tuesdays I'm dispensing in the pharmacy. I've actually gone to different Relojs to do the dispensing, so I'm not just in one store, which has been really nice. I get to meet a lot of different people, a lot of different personalities. And then Wednesdays, CMRs, flu clinics, and then point of care, which is basically just setting up a booth and doing blood pressure, cholesterol, blood glucose, A1C, just typical clinical services that most independents usually start offering, which has been really good. And then on Thursdays, I do research at a clinic. So that's my research project. I'm in a clinic and I'm doing heart failure and COPD education, counseling, medication review to try to see if we can improve quality of life, improve symptom control, and decrease readmission rates. So that's been really good. I kind of pushed that when I first started as a resident. I wanted more of a clinical focus, and they did some research, and they've started that we got a grant for this research project, and so that's kind of been one of my big pushes. And then on Fridays, usually as a UNC resident, we've got seminars usually, and then on Fridays that we don't have seminar, I just kind of do medication reviews or dispensing. And you can kind of see with that schedule, and it varied with Jacksonville. That resident is actually very laid back and didn't really want a set schedule. She just kind of goes in and does whatever is needed. If a CMR shows up, then she'll do it. If not, she'll be in the pharmacy dispensing. So she's definitely got a lot of flexibility, but they adjusted that based on our different personalities. I love more structured, she loved more laid back, so they're very open to adjusting that for us.
All right, I'm very excited for talking to you today about Moose Pharmacy. So in this slide here, we have actually 5 locations. These are 2 of our stores here. Moose Pharmacy at the very top is our Concord location, and that's where my co-resident Shannon and I are located currently. And then the flagship store is the Moose Drug Store that you see with the Moose branded on the side. And below there, you'll see our innovators. There is Joe Moose and Ashley Branham. They've been great leaders through this program that we've had so far, and actually nationwide, which I will speak on a little bit in just a few minutes. Our responsibilities here, so this is a chart that I've laid out for you to see. It is very flexible, but as you can see here, on Mondays we have a store meeting, which we are very involved with giving input in how workflow and everything is going at that Concord location. And Tuesday is a strategic call. On the strategic call, Shannon and myself get to play a big role in this and talking about different clinical services that we have, and that's with all 5 stores' pharmacy managers. So we play a big part in that strategic call and get agenda items onto the call. Wednesday, we can have admin time. Like I said, this is flexible, so this can be scheduled throughout the time there. And, of course, all 3 days there, we're focusing on patient care activities, of course, and we'll go through those in just a few minutes. On Thursdays, we do staffing in the evening, and then Saturday we staff once a month. So staffing there, we do have our responsibilities with staffing, but they do really appreciate our clinical service that we provide there. And Fridays, we do have topic discussions with our students about 1 time a month, and then like Ryan mentioned, we do have seminars. So most of these are ongoing throughout the year. So speaking a little bit more to the longitudinal experiences, we precept a great number of students. We've had students from about 4 different schools at this point. And then, of course, we do CMRs, and we do seasonal flu clinics, which is that just ended here. And I think we did about 15 flu clinics outside of the pharmacy this year, which was very successful. And then, of course, we do some community outreach, go to some fairs, do some health fairs. So a lot of different opportunities with that. And then electives is a big part, too, that I will get to explore in the spring. So electives are pretty much whatever your interests are. You get about 2 weeks that will apply to electives. And I haven't decided what I want to do yet, but I'm filling out non-patient care or indirect patient care activities. So I'll be looking at that in the future, but they're definitely open to many different experiences in that realm. Alex, can you advance the next slide, please? Just one moment, maybe a technical difficulty. All right. So this looks a little bit different than originally laid out, but it's pretty similar. So these are quite a few of our services that we offer there at Moose Pharmacy. I want to lay this out for you. So I tried to display the size of the bubble here. So precepting is a very big responsibility of Shannon and I. We are not the formal preceptor, but we are the direct preceptor pretty much. So they've let us play an active role in that, and I've really appreciated that because I do love the teaching and mentorship that comes along with precepting. So far, we've had 17 students, and that's been a growing experience for me, and I've very much appreciated it. North Carolina issued a standing order for naloxone on June 20th, and so this was Shannon and I's major project from the very beginning of residency. So getting the workflow down for identifying patients, teaching the staff. So we actually went to all 5 locations and taught the staff how to identify patients and talk to the patients once identified. So this has been an ongoing project. Pharmacogenetics is something I'm doing for my business plan, and I just got certified in pharmacogenetics, and so I'm looking to begin that within the next month or so. So I'm very excited about that. The Diabetes Care Club is something that Moose Pharmacy just started probably a couple months ago actually. So with the Diabetes Care Club, we offer free diabetic supplies. In addition to that, we're actually going to offer an educational piece. So my co-resident, Shannon, is getting started with an accreditation with the AADE with getting accredited to provide these services and get reimbursed for them. The lidocaine protocol is something new that we began just very recently. So with the lidocaine protocol, we're looking at seeing how we can affect patients within their controlling their pain. And once again, doctors and physicians are looking to lower their prescribing patterns in controlled versus non-controlled. So they really like this option too. So tomorrow I will be going to Union County, which is an employee-based wellness program. And so this is our AmCare experience there at Moose Pharmacy in UNC. So what we do there is we go in, we set up appointments with patients on our own based on a list that we're provided, and we meet with these patients and see what their healthcare goals are. Those sometimes turn into a little bit more than healthcare, maybe some lifestyle things too, and maybe just life. But it's really fun to interact with those patients on a different level than just the normal day-to-day pharmacy experience. Medicare is one that we recently endeavored in. We had to develop a workflow for this and implement this into the pharmacy and train the staff with this one also. So Part D open enrollment is current and ongoing, as you may know. And so right now we're in full swing in that, and it's going very well. Home visits is something else that we do. And so with that, we go into the patient's home and enroll them into our adherence program. In the adherence program, just like Casey mentioned earlier, we do have bubble packaging there at the pharmacy, and that's a huge staple in our business. So we onboard these home visits, and with the adherence program that we offer, we actually do CMRs with the patient when initially enrolling them. And throughout the time that that they're getting their medications at the pharmacy, we're actually performing many CMRs each month, focusing on certain disease states. So we're not just filling the medications each month and letting them go. We're actually focusing on the patient as a whole. So that's been very exciting to deal with the patients. We do have some compounding experience. That's definitely tailored to your interests. So I go in and make sure the weights are right before the compounding technician goes forth with her efforts. However, I'm not as interested in compounding, so I'm not in the compounding lab very much. But once again, if that's your interest, you can definitely get some. Immunizations is a big staple there at Moose Pharmacy also. Just like Ryan mentioned, they did a lot of flu clinics recently and gave a lot of flu shots. And so that's definitely a public health issue. So that's exciting to take part of. Veristat and HAP Innovations is a project that I'm involved with right now. So I'm pretty much the project coordinator with that. We coordinate and dispense medications, the bubble packs, in electronic dispensing devices. And what's really cool about these is it's a hub of information that reminds the patients when to take their medication and also how they're doing with their disease state. So it has typical disease state questions that are asked. And all of that information can actually go back to the physician and the pharmacy. So it's really exciting to be on the cutting edge of technology there and seeing exactly where we're going with healthcare in the future. Speaking of healthcare in the future, I'd like to talk to you a little bit about CPSN. So as I mentioned, Shannon and I are associated with some strong leaders there at Moose Pharmacy. The CPSN, I'm not sure how many of you have heard of that, but it's the community. It's looking at improving health outcomes and decreasing the cost of care. A value-based service. So that's very exciting to be actually in general traveling around the country to start these CPSN networks across the nation. And so I've gotten to be a part of that back at my home state in Mississippi and seeing we do have some specialty pharmacy that can be offered. Once again, that's tailored to your interests. And we do a MTM there, and we also offer a Diamond program. Very much in a nutshell, but we'll be happy to answer any questions that you may have about those. And, of course, here are some helpful resources and our program director, which we failed to put her contact information on there, but her name is Dr. McCary Marciniak. And you can, of course, reach out to Ryan and myself, and we can get you in contact with her if you'd like.
Well, thank you, everyone, for sharing some information about your programs. We will now move into our discussion portion of the webinar. If you have any questions to all of our students on the line at this time, please type them into the chat box, and I will queue them up for our resident panelists. The first question that came in is actually for Anna. So Anna, Cortez Davis wanted to know, do you think that a non-accredited residency will have an impact compared to an accredited one?
An impact, or does being non-accredited have an impact on me, perhaps? I think that realistically, in community pharmacy residencies, it depends what you want to do after. If you want to do a PGY2 in AmCare, there's a potential that being in a non-accredited program could limit me. But that's not necessarily my goal, so that wasn't a limiting factor for me. And so for me, the limitation of being non-accredited is that I cannot sit for the BCPS pharmacy pharmacotherapy specialist examination next year. Being in an accredited residency, you're eligible for that right away, whereas in my case, I'll have to wait a few years. But for me, I'm not in a big hurry to take another set of exams, and so for me, that wasn't too much of a hindrance in this program. But as I emphasized, my weeks are split up into just like every other accredited residency would be. I do not feel that I am being taken advantage of in any way, and accreditation is there to create standards, and so that each program is receiving, or each resident is receiving kind of the experience that was presented to them. And so I still feel that I'm getting that, even though we're not accredited. So I hope that helps answer that question a little bit.
Thanks, Anna. Our next question comes from Scott Brewster, and I think I'll maybe see if one of you, Brian or Cody, can answer this one. When evaluating programs in your application, how did you consider opportunities during the residency that you may not have background with prior? For example, hormone replacement therapy.
Cody, do you want the phone or you want me to take it?
Do you have any experience in hormone replacement therapy?
Nah.
Or anything of that matter?
Nah. I mean, I guess I looked at the sites in choosing which ones that I applied to. I looked at it based off of location and what kind of experience I could get with it. There's a UNC site that does do hormone replacement, and I chose to interview there based on geographical location and because they offered that, which is something that you really don't see very often. So just a little bit of background with me. My dad owns an independent, so I kind of grew up in an independent, so I wanted something that was on a different level than what I was used to and offered a lot more that I just have not had much access to. So that's kind of how I limited where I applied.
I'm sorry.
Go ahead.
Okay. I would say if you do have, if maybe that wasn't your interest to begin with, you can go into the residency with an open mind, and then maybe that's something that you're interested in once you get there. And if not, they will recognize they're very upfront with what you're interested in. So if that's something you're not as interested in, definitely you don't have to go forth and do that. But if that is something you really are interested in, you can actually put a lot more detail into that part of the residency experience.
Thanks. Anna, did you want to chime in?
No, that's okay. I think that was a great answer.
All right. I'll turn things over and ask Casey. I know you mentioned that you have a co-resident. Can you describe the benefits of having a co-resident? And do you and your co-resident work on projects together, or are there other opportunities to learn from one another?
So I do have a co-resident, and it makes it a little difficult being away from her, I guess. So since she's in Birmingham and I'm in Florence, it's about a 2-hour drive away. So so we do communicate a lot through text or email, but working on projects together, we do that all the time. So I mentioned that we do participate in presenting a continuing education opportunity. So our presentation for that is actually due in a few weeks on December 2nd. So we'll email back and forth and email our presentations to each other and get ideas from each other and, you know, bounce things off of each other and, you know, just help each other a lot, you know, before we send our presentation to our residency program director. So it helps with that a lot. And then as well, since we're distance, it helps a lot, you know, get us on the same page whenever we communicate back and forth like that. And we do have the teaching certificate and research certificates and things that we have to be on campus at Stanford for. So a lot of times I'll go and stay at her apartment with her. So she also serves as housing for me sometimes, which is nice. So we just try to do as many things together as we can and talk about things as much as we can. So it's nice to not be all by yourself and feel like you know, can't ask the stupid questions or something like that. So I'll ask all my stupid questions to her, and we'll communicate really well and help each other out with anything that we need from each other. So. I hope that answers the question.
Thanks, Casey. The next question comes from Austin Hilverding, and this is for anyone on our panel who might be interested in pharmacy ownership. Do you feel that your residency program provides opportunity for growth towards a career in pharmacy ownership? I know there are residencies specific for pharmacy ownership, but how do you feel your respective programs compare?
I'll take that one. So like I said, my dad owns Independent, so that's actually my goal, is to go back and buy out his pharmacy and then basically implement all the services that I'm learning with my current residency. And that's kind of what I try to look for, is just innovative pharmacies that I knew were doing stuff that I'm not used to and I wanted to look into more to be able to implement myself. And I feel like at Reloj, they have opened up a pharmacy just about each year since they've started. So like I know this year they're opening up a new pharmacy in about 2 weeks. So I'm going to go watch and kind of see how that process is being done, all the little roadblocks and stuff that leads up to opening day, and just getting all of that exposure. Because the owner of Reloj is very business-minded, so I feel like I'm learning all that I really need to from him while still being able to learn all of the clinical services that I want to basically transform my dad's pharmacy into as well. So I feel like I've gotten a good mixture of both.
At Kelly Ross, there are 4 pharmacy owners. And I haven't gotten into the in-depth experience regarding management and ownership, reviewing the financials and all of those things. But I think for me, my goal has been to be a clinical community pharmacist, and I think that I'm certainly getting that experience here. I think it's important to highlight, too, that at Kelly Ross, the last 2 residents have stayed on with the company to continue to develop their skills in various positions in more of our clinical type of roles. And so when you talk about ownership, I think it just kind of depends if, at least in regards to the Kelly Ross program, I don't know if ownership is necessarily emphasized, but I think that kind of as he was just stating, that being in a residency is, a community pharmacy residency especially, is really about learning how to run a clinical service and know how to justify that. And I think here at Kelly Ross, we're really, I'm going to come back to provider status and how that's really going to flip the script over here. And that could create a whole different business model for what is a pharmacist, what is a pharmacy. And I think that here I feel like my boundaries are even more, they're farther beyond owning a pharmacy. It could be owning myself as a business. And so I think that it just really depends on kind of what your goals are and what you want to take away from it.
Thanks, Anna. And students, we are running short on time, so I won't be able to get to all of your questions. So if you have a specific question for a program or a particular resident, please feel free to send them an email this evening or sometime in the near future. The next question comes from Shushanta Shakar, and her question is whether when applying to residency, if you apply directly to a pharmacy school or to a actual community pharmacy like Reloj or Moose. And I'll go ahead and tackle this one. Shushanta, it really depends. Each pharmacy residency program is not created equal. Some programs will be majority based out of a college of pharmacy, and some are based out of the pharmacy itself. And then there's some that almost share the resident equally. So you'll have to go through the ASHP residency directory, and each residency is assigned a number through ASHP. And when you apply, you'll apply using the specific number to the specific site. So for instance, for UNC, each site, Reloj and Moose, will have a different number associated with it. And our next question comes from Chantel Houston. With so many services offered at your pharmacies, it's overwhelming to keep track of everything you're involved in. About how much time is spent working on things outside of normal business hours? Casey, why don't you chime in first on this?
So a lot of what I do at the pharmacy, I can't really do at home. It involves a lot of patient information and requires access to our pharmacy records at the pharmacy. So a lot of it, like I said, I can't do at home, but projects and things such as the CE that I'm involved in, any teaching presentation. So we actually taught on what a clinical coordinator is at Sanford recently. So that presentation, anything like that, I can work on at home, and I'll take that home and work on it just because I know that I can do stuff like that there, and I'll spend more time at the pharmacy on things that I can only do there, like MTMs through Marixa, or we also have the iMedicare software as well, where we pick the best Part D plans for patients, and so I do that there. So anything that's patient-oriented, I do solely at the pharmacy, and then anything outside associated with the residency, I usually try to do at home just because I try to utilize my time most wisely at the pharmacy because I know I need the resources that are there. But I would say, I don't spend a lot of time outside the pharmacy working on things. I mean, it may be a couple hours each night. It's not very overwhelming.
Thanks, Casey. Let's take one more question here. Let me see. Now, it sounds like most of you work very closely with precepting students. I know some of you have already discussed your role in precepting students. For those of you that haven't, could you talk a little bit more about what that experience is like and whether or not you are going to pursue a teaching certificate? And if you don't choose to pursue the teaching certificate through your program, are there other ways to get that training that you need to be a good preceptor? Ryan, do you want to take this one?
I mean, you're not leaving me much with a choice. But yeah, so Relo, we get a lot of students, but not specifically at my site. So I think I've only had 2 or 3 students so far, which I've helped precept and just giving them assignments, interacting with them with the clinical platforms like Marixa and Outcomes. But when there's a lot of students outside of my site, we do a weekly conference call where it's always hosted by the resident, and we just kind of alternate months. And then so one day a week they'll get an assignment and they'll have to do presentations on whatever it is, and then we talk about it. Usually it's pertinent to community pharmacy, whether it's vaccines, pharmacy law, stuff like that. So even if they're not physically there, we always have access and exposure to the students. As far as the teaching certificate, I'm not doing it because I don't really have much of an interest in teaching in the future. But there's still plenty of opportunities that I'm having to be able to teach. I'm actually doing a CE this Thursday, a new drug update. So I'm still getting that exposure. And then as far as the experience with precepting, I think the biggest thing is just exposure with the students and just jumping out there and doing it in kind of like a trial and error. Unless you want to be like a formal teacher, I'm not really sure how beneficial a teaching certificate would be. I know relative to precepting, it's just going to be kind of trial and error and seeing what works and what doesn't work.
I'm just going to chime in and add a couple things. This is Anna with Kelly Ross. So I don't have any co-residents, and my program is not affiliated with the University of Washington. And so for me, the teaching certificate has not only been a way to advance myself with my teaching skills, but also a way for me to connect with the university and to network with other residents in the area. And so for me, it was more than just the face value of here's a teaching certificate. It was really for me a connection and a way for me to build connections with others.
Thanks, Anna. We'll go ahead and close things off with one final question. And this question is for everyone on the panel. And post-residency, where do you expect to be? Do you think you'll have a position at the pharmacy you're currently completing your residency at? Or what are your long-term plans? Why don't we start with Casey?
So I don't expect that I will get a job offer with the pharmacy that I'm currently at because there's not really any job openings there since we're a small independent pharmacy, and we only currently just have the one store. Also, they did hire their last resident, so the resident that was there before me is now a full-time pharmacist there and is their clinical coordinator as well. So I won't be staying, but I'm sure if they did have a position open that they would hire me, especially since the resident before me was hired as well. But post-residency, I expect to be hopefully either working in another independent pharmacy, or since I do sort of have an ambulatory care experience since we have the clinic next door, I'm thinking about also working in maybe an outpatient clinic or something like that through a hospital.
What about you, Anna?
Well, as I said, the last 2 residents have been, they've stayed on with Kelly Ross. And so for me right now, I think my goal is to stay, but we'll just kind of have to see what the opportunities are. I think that I feel lucky in that we have, 6 different divisions, and with 5 of those having, or 4 of them having physical, 5 of them having physical locations. And there are a lot of shifting, moving pieces and people. And so I'll just have to kind of see what the environment looks like. But again, with medical billing and pharmacists having provider status over here, I think that there might be some opportunity as kind of our business models shift a little bit over here. So I'm open to opportunities, and I'm curious to see what happens in the next few months.
Ryan,
Yeah, so I'll be going back and basically buying out my dad and running that independent pharmacy while also looking to expand, maybe start a different location. But in general, Reloj would love to have me. They have hired a past resident before, and their goal is they're spending a year investing their time and resources into a resident, so they would love to keep them. So there would definitely be a spot if I wanted to stay. That's just not. I would love to stay with them, but it's just not what I'm kind of pushing to do for my future.
Close us out, Cody.
All right. So I want to say, first of all, that Moose Pharmacy does have a history of hiring on their residents. So that is one point. The other point is that they do empower their residents to go out and build their very own job, too. So, for instance, Moose Pharmacy opened 2 pharmacies in the past because of residents having visions for owning a pharmacy. So if you present something of your interest, they're willing to seek after that. Keep in mind, too, that you can develop this service. You can develop a service during your residency that prolongs onto outside of residency. So that could be your job after residency. So keep that in mind, too, moving forward. As far as my interest long-term, I am all over the board. So, like I said, Moose definitely empowers you to go out and create your own job. So I have interest in things with Moose. I'm not sure the possibilities there yet, but I'm also interested in indirect patient care, so very big picture things. So I think residency has definitely empowered me with direct patient care experiences to apply in an indirect patient care environment.
Thanks, Cody, and thank you to all of our speakers tonight for that excellent discussion. I do want to let you know that some of the residents on today's call, as well as myself, will be available in person to talk to you about our programs at ASHP's mid-year clinical meeting next month in Las Vegas. Please refer to the ASHP mid-year clinical meeting website for the residency showcase listing to find the specific times and locations where each program will be showcasing. That list, according to the website as of this morning, will be available on the 17th. And I believe UNC will be there. Am I correct?
You are correct.
Casey, is Dr. Galdo going to be at the meeting this year?
He will.
All right. And Anna, I don't believe you all are going to be there. Is that right?
We will not. Oh, nope.
So you'll have to get Anna by email or call her or go up to see a visitor. Well, if there are no more questions, I want to thank you all for joining us today for another NCPA Future Pharmacist Series webinar. Please don't forget to register for our final webinar on postgraduate training opportunities that will be on Thursday, November 17th. Not only will we have residents from across the country, we'll also have residency directors on hand to field your questions. Don't miss out. If you have any questions, please do not hesitate to reach out. You should have my email in your email. So thank you all and have a good night.